Today, we will talk about diseases of the thyroid gland. The thyroid gland is considered the master of metabolism because of its regulation over the body's energy utilization. Here's a picture of the thyroid gland. It is located in the anterior portion of the neck, in front of the trachea. So the thyroid is located in the anterior portion of the neck, in front of the trachea. The thyroid is regulated by thyroid-stimulating hormone, or TSH, and this is secreted from the anterior pituitary gland. The thyroid gland produces, stores, and releases thyroid hormones. They are triiodothyronine, or T3, and thyroxine, or T4. Thyroid-stimulating hormone is released from the anterior pituitary gland. The TSH from the anterior pituitary stimulates the thyroid to grow. The TSH from the anterior pituitary stimulates the thyroid to release T3 and T4. And T3 and T4 prevent the release of thyroid-stimulating hormone. Because of less thyroid-stimulating hormone, the thyroid will shrink and release less T3 and T4. When thyroid hormone levels are high, this prevents the release of more thyroid-stimulating hormone. When thyroid hormone levels are low, this allows the release of more thyroid-stimulating hormone, and this is a negative feedback loop. In this diagram, notice that the brain releases thyroid-stimulating hormone, which stimulates the thyroid gland. Once the T3 and T4 are released, thyroid-stimulating hormone is inhibited. T3 and T4 hormones increase the rate of cellular chemical reactions in almost all cells of the body, thus increasing the general level of body metabolism. The thyroid gland also secretes calcitonin, which promotes absorption of calcium in the bones. This absorption of calcium by the bones decreases the level of calcium in the blood. We will talk more about calcium when we discuss the parathyroid glands. The thyroid gland uses iodine to make both T3 and T4. T3 is the active form, and T4 is the storage form. T4 is converted to T3 inside of all the cells of the body to become active. Thyroid function tests. Thyroid-stimulating hormone can be directly measured. Free T3 can also be directly measured. T4 must be measured indirectly. T4 is measured by radioimmunoassay, or RIA. T4 by RIA is also referred to as a T7 because a resin T3 uptake has been done first to correct for certain medications such as birth control pills, other hormones, seizure medications, and cardiac drugs. Even aspirin may alter the routine T4 test. So thyroid binding globulin is TBG, and most of the thyroid hormones in the blood are attached to a protein, and this protein is called thyroid binding globulin. If there is an excess of deficiency of this protein, it alters the T4 or T3 measurement, but it does not affect the action of the hormone. If a patient appears to have normal thyroid function, but an unexplained high or low T4 or T3, it may be due to an increase or decrease of TBG. And direct measurements of TBG can be done and will explain the abnormal value. Either high or low levels of TBG causes no problem except falsely elevating or lowering the T4 level. These people are frequently misdiagnosed as being hyperthyroid or hypothyroid, but they have no thyroid problem and need no treatment. Diseases of the thyroid gland.